Today we will be reviewing Saebo's functional dynamic orthoses, including the SaeboFlex and SaeboReach. We will also be reviewing the dynamic resting hand splint called the SaeboStretch. These products are specifically designed to treat neurological patients such as stroke, brain injury, spinal cord injury, and cerebral palsy, to name a few. We will also review clinical outcomes and videos, as well as related research. Now let's look at Saebo's products. The top left photo is our premier product, called the SaeboFlex. It is a custom fabricated wrist-hand-finger orthosis. It is purely mechanical and spring-loaded. There are no electronic or motorized parts. As the patient goes to grasp, the spring system reopens the fingers. There are 4 different grades of resistance of spring that the therapist can choose from for the fingers as well as the thumb. The spring grade will depend based on how much tone and soft tissue shortening the patient has. The middle photo is called the SaeboReach. It is a custom fabricated elbow hand-finger orthosis. As you can see in the photo, it is a SaeboFlex combined with an above elbow component. This device is specifically designed to work not only with folks that have hand limitations, but also lacking elbow extension. As you can see, the 2 tension cords attached to the SaeboFlex to assist with straightening the elbow during functional activities. The product on the right is called the SaeboStretch. It is a dynamic resting hand splint that is specifically designed to protect the joints while stretching the long finger flexors, as well as the wrist flexors. We'll discuss these products in detail later on in the presentation. The bottom 2 photos represent our prefabricated kits that are available to facilities. The kit on the right is our inpatient kit. You can treat up to 6 patients at one time. It comes in all sizes for the SaeboFlex, the SaeboReach, and the SaeboStretch. The kit on the left is a smaller version of the inpatient kit. This specific kit is geared towards long-term care centers, private clinics, as well as small community hospitals. What is the SaeboFlex? As discussed previously, it is a dynamic custom fabricated wrist-hand-finger orthosis. The spring system for the fingers and thumb assists in reopening the digits following functional grasping. To give you an idea of how the spring system works on the SaeboFlex, in this video we have a normal subject flexing and extending the fingers. As the subject flexes, you can see the spring stretch or deflect in the fingers and the thumb. As the subject relaxes or extends the fingers, you can see the spring system recoil. Once the SaeboFlex is on, it is time for the clinician to prescribe an activity based on the patient's movement deficits. When the patient needs to complete the activity, they will grasp an object using his or her volitional flexor control, place the object in a specific location based on the movement deficit, and then relax the flexor tone sufficiently to allow the extensor spring system to reopen the fingers and thumb. In order to qualify for the SaeboFlex, there are certain criteria that must be met. Patients that exhibit some shoulder and elbow movement and limited hand function to no hand function may qualify. Specifically, patients will need 15 degrees of active arm elevation at the shoulder. That could be shoulder flexion, abduction, or scaption. They will also need 15 degrees of active elbow flexion, as well as a quarter range finger flexion, or 25% of a fist. With this specific movement criteria, the patient would then qualify for the SaeboFlex. If the patient is suffering from contractures that would prevent the patient from putting their wrist in a functional position, along with their fingers straight, further evaluation will be needed. The SaeboFlex was originally developed out of frustration. Oftentimes, patients were being discharged from clinics with little to no hand function. A majority of neurological patients that suffer a stroke lack the ability to extend their wrist and/or fingers. They do not qualify for current treatment techniques such as constraint-induced movement therapy. This group of patients would be considered to have moderate to severe impairments. The SaeboFlex was developed specifically to work with this population so they can take advantage of the latest research that promotes highly repetitive, task-specific training. There are numerous goals that we have when using the SaeboFlex for our patients. One of the most important goals is to incorporate the hand functionally as soon as possible post-injury. Also, decreasing learn non-use, improving learn use, reducing spasticity, and improving range of motion, strength, and motor control are very important. As the patient starts to use their hand for the first time, psychological changes are usually noted. Their quality of life is a very important factor, and we also notice that motivation increases. This photo depicts the ideal candidate for the SaeboFlex. Oftentimes, patients will be positioned in wrist flexion with their thumb and fingers curled. This is due to spasticity, soft tissue shortening, and poor positioning. As a reminder, to qualify for the SaeboFlex, it is not required to have active wrist or finger extension. Here is a video example of a patient attempting to pick up a cup without the SaeboFlex. Unfortunately, due to tone, he's unable to extend his fingers or thumb and properly grasp the cup to bring to his mouth. Minutes later, he puts the SaeboFlex on and he's able to complete the task. By putting the SaeboFlex on, it puts your hand in a functional position. He's then able to grasp the object, and the spring system allows his fingers to reopen. Now here's an example of the patient trying to pick up a spoon and transfer food from one bowl to another. As you can see, due to exertion and effort, the tone kicks in and he's unable to complete the task. And you can also notice a lot of compensation. Minutes later, he puts a SaeboFlex on, uses a built-up spoon, and he's able to transfer food from one bowl to another with minimal compensation. The reason why the spoon is built up is because the SaeboFlex was designed to be used with 3 to 4 inch size objects. Finally, here's an individual attempting to pick up a ball and transfer it to the yellow tube. As you can see, she has no finger extension or wrist extension. Minutes later, with the SaeboFlex on, she's able to complete the task of grasp and release. From a therapist perspective, this opens up the opportunity to work on numerous activities now that the hand can be engaged. As far as functional activities while using the SaeboFlex, there are numerous activities that the therapist can use, whether it's the ADL kitchen. They could be putting food away into the refrigerator or freezer, stacking items in the dishwasher. You can also work on elbow flexion and distal control by grabbing the phone, and as they improve, work on external rotation as they bring it to their ear, or put some confetti on the table and work on a sweeping motion to work on elbow extension or trying to decrease trunk flexion. So there's a lot of activities that you can use while using the SaeboFlex that are very functional, in addition to trying to remove the SaeboFlex so the patient no longer needs the device to perform functional activities, similar to a cane or a crutch. I would like to share with you a sample video case trial from our program in the United Kingdom. The woman you're about to see is a stroke survivor, 4 years post-stroke, based out of England. Notice how the patient has limited arm and hand function. She has to pry her fingers over the ball to attempt to grab the object. This tells me she has moderate to severe spasticity. After 5 days of treatment, she did not make significant gains. However, she can grab the object with her arm or side of her hand and release into the yellow tube, but significant progress was not made. She then went home, did the Saebo program daily, and communicated with the physio using a diary. Here is the
Good. And then
post
the smaller one.
15-month
Fist
follow-up.
for me. And open your hand. Lovely. So can you bring your arm up to your mouth as much as you can? Go on, pull. Go on a bit more. Go on, get it there. Just wiggle your fingers. Good, and make a fist. And open your hand.
This was a really wonderful success story. Seeing her 15 months earlier on baseline, prying her fingers open, attempting to grab the ball with moderate to severe spasticity, and now 15 months later, exhibiting volitional finger extension with the wrist above neutral is remarkable. Is this going to happen to all strokes patients that are 40 post-stroke with moderate to severe tone? Of course not. But is the opportunity and the hope there for many? Absolutely. I would like to now discuss the SaeboReach. As mentioned previously, the SaeboReach is a custom fabricated elbow, wrist, hand, finger orthosis. The dynamic component of the SaeboReach is on the back of the arm. The tension cords insert onto the SaeboFlex form shell and can be adjusted by the clinician based on the amount of assistance needed for extension. The SaeboReach is a wonderful option for patients that not only lack elbow extension, but also have supination and pronation limitations. The tension cords can be adjusted to assist in either motion. I would like to now review with you a video case trial of a patient who suffered a stroke. He came to the clinic 6 weeks post-stroke. We provided him with Saebo treatment 3 times per week for 9 visits. Each session was 45 minutes with a home program of 2 45-minute sessions per day. The activities were repetitive task-oriented arm drills using the SaeboReach and gross motor equipment.
Go ahead.
Here's his baseline video at visit 1, attempting to grab the ball. As you can see, he starts to compensate and lacks wrist, finger, and thumb extension. He is unable to complete the task.
Go ahead. One more time. Okay, stand up again.
Now, the SaeboFlex is down onto the patient, and his fingers on stretch, hand in a functional position, and we are going to ask him now to grab the ball and place it into the crate. As you can see, the compensation has decreased, and he's able to complete the task of grasping and releasing. Notice how his movements are a little quicker as well. Here he is on visit 8, using the SaeboReach. He's now able to fully extend his elbow with the assistance of the SaeboReach as he crosses midline to relax and drop the ball in the crate.
You're recording now, so you can pick it up,
Here he is,
and then you're going to
picking
drink
up
it with
the
that affected side, right?
water bottle and bringing it to his mouth for the
let's
first
see.
time.
You can do it.
Yes! All right.
Good job.
If you guys want to see something, you should come over and watch. I got to embalm a body later today.
He just mentioned how he had to embalm a body. He's a mortician, so of course they laughed at that one. And here he is manipulating the SaeboFlex, which we do not recommend patients
Look at
do.
those fingers.
But for illustration purposes, you can see him showing some nice fine motor prehension. That's the type of stuff you have to practice at home now, is trying to do stuff like that. Good job. Now that we've discussed the SaeboFlex and the SaeboReach, I would like to review with you the dynamic resting hand splint called the SaeboStretch. Notice how the handpiece is flexible. When tone kicks in due to associated reactions such as coughing, sneezing, laughing, or postural adjustments, The hand wants to move into flexion. With the SaeboStretch, there are energy storing hand plates that will allow the fingers to move into flexion safely, and as the tone subsides, it will reposition the fingers back to a neutral position. When you look at these traditional splints, they are all rigid, static hand plates. When the tone kicks in and the fingers curl, this will lead to joint pain and damage. The main purpose of the SaeboStretch is to protect the joints while stretching the long finger flexors and wrist flexors. The SaeboStretch comes with 3 interchangeable hand plates. Yellow, which is the weakest hand plate, followed by red, which will be assembled on the device when you receive it, and blue, which is the strongest hand plate. The yellow and blue hand plates will also be accompanied in the box. Other main features include the malleable wrist mount, malleable thumb mount, a 5th digit strap just for the 5th digit, non-slip strap so the fingers stay exactly where you want them, a palmar pad to preserve the palmar arch, and a breather-proof cover that can be removed for cleaning. The SaeboStretch has reimbursement for Medicare and many commercial insurance carriers. For more information, please call Saebo at 888-284-5433, and we can find a DME company or an orthotist prosthetist company that would be able to work with you in billing your patient's insurance. Now that you learned a little bit about the SaeboStretch resting hand splint, please feel free to click on either link. The first link is the Saebo website, and the bottom link is our YouTube channel to watch a SaeboStretch fitting video where you'll see a patient fitting a patient who qualifies for the SaeboStretch who exhibits moderate to severe spasticity and soft tissue shortening. So it's a real good instructional video to see how the SaeboStretch can be positioned correctly on a neurological patient. There are numerous articles, case studies, abstracts, poster presentations that have been done by universities, private clinicians, hospital systems, students. Feel free to contact Saebo to get a list of some of those articles. We also have been mentioned in several textbooks that are worth noting. The bottom 2 left textbooks are occupational therapy textbooks. One is by Pedretti and the other one is Mariano. The bottom 2 right textbooks are also wonderful resources to add to your library. One is a stroke recovery and rehab textbook that just recently came out, as well as the spasticity textbook.